Now, from CBS News Miami, this is Facing South Florida with Jim DeFede.
Welcome to Facing South Florida. I'm Jim DeFede. Let me start by wishing everyone a happy Easter. Now, I'm not a particularly religious person, but I will tell you that Easter is one of my favorite holidays because at its core it represents eternal hope, the belief that from darkness there can be light. I like that sentiment a lot. Unfortunately, living in Florida, we have a lot of sunshine, but not enough light. And that brings me to today's show. As we speak, nearly 1 million Floridians, many of them children, have lost their health insurance because the state has created a Medicaid system so dense and complex that more than 960,000 people have lost their health care coverage, not because they are no longer eligible, but because of what is termed as procedural reasons. Let me explain. During the pandemic, nearly 5 million Floridians received expanded Medicaid benefits. When the pandemic was declared over a year ago in March of 2023, the state began a process known as the unwinding. During the unwinding, everyone who had been receiving extended benefits needed to reapply to prove they were eligible. That's fine. But the system created by the state is so bad, nearly 1 in 4 either haven't received the forms or can't understand them. Florida Health Justice is now suing the state of Florida, and I spoke to Lynn Hearn, the lead attorney for the group.
Our concerns are that the unwinding has really shined a spotlight on problems with the Medicaid redetermination process that have long been there, but maybe didn't get the attention that they deserved. But now we are seeing in such record numbers that the process of redetermination itself is broken and is not really designed in a way to enable the majority of eligible people to stay on. There are so many obstacles on the way. So that's our concern.
So obviously, right now, I think the total number of people who have been processed to date is about 4.3 million. We were talking earlier, out of the 4.9, there's still a little bit of a lag. They're still catching up with it. But of the 4.3 million, from the numbers that you've seen, my understanding, you told me earlier, only 9% were automatically renewed. That seems like a very small number. Is it a small number in your opinion that just 9% were automatically renewed?
It's not just a small number, in my opinion. I mean, there's groups that track this data nationwide, and Florida is routinely in the bottom quartile of states in terms of being able to conduct electronic renewals. So that's one problem. I mean, we like to think of ourselves as a pretty technologically advanced state with a lot of access to databases and automated processes, but that number speaks volumes as far as what we're not able to do.
Well, I got to disagree with you a little bit, Lynn. I'm not sure that Florida is known as a state that does processes really well. A lot of this reminds me of the issues that the state had, at the beginning of the pandemic, just on unemployment rates and unemployment reimbursement and qualifying for unemployment. We remember the long lag times and the nightmarish process. But I'm not trying to drag you into that, but I'm just saying that the state doesn't necessarily have a great track record. And in looking at some of the other numbers, 21% were renewed through this process where they received the paperwork, they were able to fill it out, submit it, and were able to get it. But on the flip side, 22%, so actually more people were disenrolled because of procedural issues. What could some of those procedural issues have been? What does it mean to be disenrolled because of procedural issues?
It's really anything that is not a substantive eligibility determination. So it could be that a person didn't receive the notice. It could be that they weren't able to get onto an online account in order to submit paperwork. It could be that the state was unable to verify some of the paperwork that they submitted. It could be that a notice went to 2 addresses ago, and these are all things that we've actually seen in our practice that have happened. that have caused people to be procedurally terminated. And just another way to look at that data in terms of the number of procedural terminations. I looked at this before we started talking. Of the number of people that are being terminated from Medicaid, 70% of them are being terminated for procedural reasons rather than for substantive eligibility reasons. So before we were talking about the number of overall process, but of termination, 70% are procedural. So that's concerning.
What we're talking about, just to put numbers to it, is nearly 1 million people have lost health insurance in Florida because of some procedural issue. Not because they were found to be ineligible, not because they no longer qualified, but because of a procedural issue. And as you said, it could have been anything from the state didn't have their current address to, there was a problem in how they filled out the forms.
There's just a series of obstacles that people encounter, starting with the notice itself, telling people what determination has been made. It's very difficult to decipher. So the next thing they do is pick up the phone and call the call center, and the call center has around a 41% rate of calls not being able to get through in the first instance because they don't have enough people answering the phones to be able to put someone on hold. And then once a person is on hold, they have an abandon rate of 42% and an average hold time in the area of 40 minutes. So not everybody has that kind of time to be able to stay on the phone. If they are actually able to get on the phone and get a person, the likelihood of getting a person who can actually answer their question correctly and completely and getting a resolution for their case it's very, very low. The state has contracted with a third party to be the initial answerer of all calls related to Medicaid, and they are intentionally a lower level of provider, and they are only able to handle the most basic of inquiries. So even when you get to a person, chances are they are not going to be able to handle your situation. So then you're talking about either another call or a transfer or a call back.
There's something deeply wrong with this. I mean, again, if 40% of the people who try to call can't even get the call answered, and then once they get answered, if more than 40% then are on hold so long that they then drop off the call, and then those who actually make it to a person end up not talking to a person who can actually help them because they don't have the information. I don't know how far you're willing to go with this, but that sounds to me like almost like the state is deliberately trying to keep people from being able to access this program and be able to be on the healthcare rolls. Again, I don't want to draw you into that, but it doesn't sound like a very efficient system to me.
Well, I have no problem agreeing with that. The call center, I think, is kind of the last indicator of a process that is broken at all of the steps that precede it. Another statistic to look at is the actual number of calls made to the call center, and we have nationwide data, and Florida is usually number one or number two for the number of calls. So what that tells you is that there's something in Florida's process that is prompting a high number of calls to begin with, because this shouldn't have to be resolved with an army of call agents. That's not the solution here, to hire more call agents. The solution is to earlier in the process have more automated terminations and have clearer notices and have better communications with clients about what's expected, so there's no need for a phone call on the back end.
And I think it's also important to point out, and I want to make this clear as well, when we talk about nearly 1 million people being denied health care because of disenrolled for procedural issues, a lot of those are children, correct?
I don't have that number handy, Jim, but certainly historically we've seen that number be about half of the terminations that are happening. So,
but you would agree that a large number of these people who are affected, this nearly a million people we're talking about, who are lost in this bureaucratic maze, are in fact children, correct?
Oh, absolutely. And we also look at the back end, the enrollment numbers for children, and we have seen about 500,000 or more children, that number of reduction of enrollees in Medicaid. So that all lines up. And that's just really concerning because the income limits for children to be eligible for Medicaid are much higher for adults. So just because an adult has lost Medicaid eligibility does not at all mean that the child also is ineligible. And families may not understand that. And so they may just assume that if they're not eligible, then their child isn't, and not take any further steps to inquire.
Am I right in believing that for a lot of these people, a number of the million or so people who are affected by this disenrollment because of bureaucracy, they won't even realize they no longer have health insurance until they show up at a doctor's office and are then told, oh, by the way, you no longer have Medicaid, you no longer have health insurance. Is that correct?
That's right. And we hear from those people. Actually, we hear doctors' offices calling and canceling appointments prior to the appointments because they have checked to make sure there's coverage and there isn't. Or worse yet, we are hearing right now from a number of parents of critically ill children who receive in-home nursing and other services, and their providers are contacting them and letting them know that they're going to have to stop coming in a matter of days because the provider has determined that the child is no longer going to be eligible for coverage. So that's putting these families in a really tough situation.
As I mentioned earlier, Florida Health Justice is suing the state in federal court. A trial is scheduled to take place in May in Jacksonville. We'll stay on top of it. But when we come back, Florida remains one of only 10 states to turn down billions of dollars from the federal government to expand Medicaid. So if the legislature won't do it, perhaps voters will. Stay with us. Welcome back. Florida is one of only 10 states that have not accepted billions of dollars from the federal government to expand Medicaid under Obamacare. Initially, when Obamacare passed, Republicans across the country decried it as socialism and refused to accept it. But over time, that has changed. 40 states, including deep red states, have now realized it is crazy to turn down federal money. Under Medicaid expansion, 90% of the cost of providing the insurance will be picked up by the feds and 10% picked up by the state. 90-10. That's a pretty good deal. But whenever I ask a Republican politician in Florida about it, they seem annoyed. Here was an interview I did with the current House Speaker, Paul Renner, a year ago.
We think that the fiscal risk to the state to take that on is in the billions and billions of dollars. And as you know, the way the federal government set it up is it would be 90-10 and it would, eventually fall off to the Medicaid rate. And so it's a major, major expense for many states, some of whom are not in the situation that Florida's in right now with significant surpluses because they took that on that huge obligation for these non-disabled working age adults. It's like somebody knocking on your door and saying, pay for my health care. That's what we're talking about. That's a significant obligation for the taxpayers.
Here is the next speaker, Danny Perez, just 2 weeks ago.
The topic of Medicaid expansion has been around for a while, Jim, and it's been litigated in the House many times and has never come to fruition. And I don't see that changing in the Florida House of Representatives. When we talk about Medicaid expansion, I think the term itself is so interesting. What does that truly mean? When we're talking about Medicaid expansion, we're expanding Medicaid potentially under that law if it were to happen. We are expanding Medicaid to an able-bodied adult. And what's an able-bodied adult? That's a person like myself who's very blessed, very healthy, a 36-year-old man who has the ability to wake up, provide for themselves and their families.
It just feels like there is a disdain for people who are working and struggling to make ends meet and who don't earn enough to pay for health insurance, but aren't poor enough to qualify for Medicaid under the old system. In February, I interviewed the incoming Senate President, Ben Albritton. He at least seemed open to it.
Let me just start with a premise of this. I am open-minded to the discussion. I'm not going to speak for any of my predecessors or anybody else that's been put in a position to be able to effectuate some kind of change or perpetuate some kind of idea. So I'm going to be very clear as well to say that I don't know a lot about Medicaid as a whole. It's a very complicated system. But if you want to talk about it 30,000 feet, is it something that I'm open to having a conversation about? That answer is yes. I'm also going to be clear, Jim, and not say once all the final perspective is understood, this is a magnitude one change. It's a big moving object, right? This idea of Medicaid expansion. Once I get to the end, we'll be thinking about this, working on it, understanding it. And then if we get to a place, the answer would be yes, or the answer would be no. It'd be based on the factors I've arrived at that point.
Now, the reality is that the best chance at making sure people do not die because they lack health care in Florida is likely through a constitutional amendment. That's how Floridians raised the minimum wage when legislators refused to do it, and that is how Floridians demanded the restoration of voting rights to felons who had paid their debt to society. And that is how the people of South Dakota, Maine, Missouri, Nebraska, and Oklahoma got Medicaid expanded, by passing a constitutional amendment. And there is a group now working here to do the same thing. I spoke to the campaign manager for Floridians Decide Healthcare, Jake Flaherty, who is hoping to get a constitutional amendment on the ballot in 2026.
We are technically a political committee, as you have to be to sponsor a ballot initiative in Florida. But we are a combination of healthcare advocates, providers, workers advocates, and concerned citizens that understand that right now Florida is one of just 10 states that has not expanded Medicaid in the United States at this point. And that's leaving 1.4 million people without access to care. And so we've seen Florida's ballot initiative process as an avenue through which we can accomplish that. And that's why we came together, and that's what we're working towards.
Of the 1.4 million, do you know how many are children?
So this is specifically to adults. So for children, they would already be covered at the threshold that Medicaid expansion covers through kid care. And so this is solely looking at people at between the ages of 18 and 64.
And what is the cost that ends up to taxpayers in general? Because obviously, if a person gets sick and they don't have, a doctor to go to, or if they haven't been receiving preventative care because they haven't been regularly going to see a doctor because they don't have health insurance, and they show up in emergency rooms, that's got to be pretty expensive, right?
Oh, absolutely. And the bigger part of that is too that care is largely uncompensated. That becomes medical debt that these families are saddled with for really, in some cases, the rest of their lives. It becomes expenses that hospitals have to pick up on their own, which gets passed along to other patients, to other insurance providers, through that. And so it's raising the overall cost of care for every Floridian. But I think you really hit it there, where it's the big cost is when we look at the effects on human lives. Folks can't go to see their doctor for regular screenings or checkups. And so something that could be easily treated, ultimately becomes a life-threatening and much more expensive scenario for them.
So obviously you're hoping to do this now, since the legislature has refused to act. You're going the constitutional amendment route. You're trying to get this in the Constitution in the same way that we saw a restoration of civil rights a number of years ago. We saw a minimum wage was placed on the constitutional amendment path, and that passed voters. We're waiting to see decisions as it relates to whether or not this year we'll decide abortion and legalization of marijuana. you're looking at having this on the ballot in 2026. Why 2026?
Sure. And you know, if we could do this tomorrow, I think we do it in a heartbeat. You know, again, Florida's in a healthcare crisis, and so this needs to happen as soon as possible. But the path to getting onto the ballot is a difficult one. You need to gather, you know, just over 900,000 signatures to get on right now. The number will be a little different for 2026, but we won't find that out till November. But that's also a very costly process. You know, you're looking at expenses in tens of millions of dollars just to get onto the ballot. And so, you know, we know that we need an on-ramp to be able to get that funding. You know, we've got a great group of volunteers that are already out right now collecting petitions throughout the state. But, you know, we're going to have to, you know, pay to put some boots on the ground eventually here. And in order to do that, we need to make sure we have the time to get the funding necessary.
The fact that Florida is one of just 10 states that has an expanded Medicaid, and again, let's be absolutely clear what we're talking about. We're talking about money that we send to Washington, that Washington is willing to send back to Florida, billions upon billions of dollars to cover people. What they would cover was 90% of the cost of insurance for individuals in Florida would be covered by federal tax dollars. The remaining 10%, and during the pandemic, it went down to just 5%, you know, would have to be covered by the state. At a time when the state has tremendous billions in surplus, it makes no sense, you know, to a lot of people that why they won't act. I mean, we talked earlier about how, name some of the states who have done this, had to do this through ballot initiative. You know, I know South Dakota just recently did it. Other states as well. Who are some of the other states?
Yeah, we've seen Nebraska, Oklahoma, Maine, Missouri, and South Dakota. You know, in South Dakota, they were the most recent. They were in 2022. And I think it's worth noting that they voted for President Trump by a margin of 25%. So this is a bipartisan issue. And I think you hit the nail on the head. It's because it makes fiscal sense. You know, this is our money. Floridians are owed this back from the federal government. And all we have to do to get it is say yes. And sort of to add to that, it's, you know, you mentioned that we're in a state of surplus right now. This is actually good for our state budget. When you add in that increased federal match going up from that 60 cents to 90 cents on the dollar, and then you account for some of the cost savings that go along with that, like mental health and substance abuse programs that the state pays in full right now, but that Medicaid could cover, we actually would save as a state $200 million a year. So we'd have $200 million extra dollars to play with in our state budget just by expanding Medicaid. And that's not to mention we've got there's an extra $1.4 billion that come along as an ARPA incentive to expand as soon as we can.
We'll be right back. If you have any thoughts or comments, feel free to contact me at jdefede@cbs.com. I do enjoy hearing from you. Well, that's all the time we have. We'll be back again next week. Until then, thanks again for watching. And again, have a very happy Easter.